I'm here with Dr. Sonia Copeland, and she has just been, I didn't even realize that your title has now changed. Why don't you share with everyone now this title of yours?
Okay.
Because it's so wonderful that you're still doing all that you do.
You know, once you have worked in the public health sector, it remains with you for life, I think. It's not something that you say you're just gonna take on a new persona. And so my passion for public health after 32 years working with the Ministry of Health and the different hospitals and in health centers, that passion is still burning in me. So while at the Ministry of Health, they had asked me to work with some of the diaspora groups. Mm-hmm. And it started with the Organization for Strategic Development in Jamaica, and then the OID, but with JAHJAH Foundation, Jamaicans Abroad Helping Jamaicans at Home. I feel like we need to say what the acronym is every time.
Absolutely.
Yeah. It became personal.
Yes, it did.
Because Dr. Trevor Dixon, the founder, I met him when he was only 8 years old. And my mom and I took him to the States because he was migrating to be with his mom and dad and sisters. And I followed Dr. Trevor Dixon's career, and this passion that he still has for Jamaica touched me deeply, really,
She's
really
talking about you,
deeply.
so you might as well walk into the frame.
Yes.
Because we're about to cry. All of us here are about to
We
cry.
were about to cry, yes. He left Jamaica at 8 years old. And, migrated, but retained this passion for Jamaica because of his grandma, And he did work with the Percy Junior Hospital, and I said, he's for real, and kept me abreast with everything. Her alma mothers were best friends. And so I said, whatever he is doing, because I know the landscape, I will facilitate his work here. So he's not just with health, he's also with the educational sector as well, and just community development, I really, really am proud of him and his entire team, and we are showing that, yes, the diaspora is at work and doing good things.
Well, we thank you for that, Dr. Sonia Copeland, but you are someone we're very proud of. And your new title is?
Okay, so I'm retired, but I am
So she
chair
says.
For the Compassionate Fund.
I want you to hear that. That's why I wanted her to say it. Do you hear what she's the chair of?
The Compassionate Fund.
What is the Compassionate
It's an
Fund?
initiative between the Ministry of Health and the National Health Fund to offer financial assistance to persons who are in need of diagnostics and services that are not readily available in the public sector. We can never have enough stations for dialysis, so we help with that as well. So it's at the heart of what I want to do for my country, and so I'm very happy to be doing that.
And that's why we had to get her on camera. Dr. Sonia Copeland is living proof of what compassion is. Yes. And here is Dr. Dixon. She took him on a plane, 8 years old.
You know what? I came to this ceremony today, and I was on the elevator and said, wow. My father passed away last year. And I said, it's the first time I'm going to give a presentation, and I'm not emotional about it because this is a happy moment and everything else. And sure enough, I hear Sonia starts to talk about my mother.
And grandmother.
And it does it every time.
Yeah.
I said before Dr. Dixon walked over that Sonia was going to get us all teary-eyed because I know that people see Dr. Dixon, they see all of us here, and they hear JAHJAH. And you're right, Dr. Copeland. We must tell them that Dr. Dixon was blessed. This was a vision. Jamaicans abroad helping Jamaicans at home. JAHJAH. We represent that. And so when you see him getting emotional, and I was getting emotional, and you see Dr. Copeland getting emotional, and Garvin is behind the camera and is probably teary too, it's because this work is not being done for profit, okay? Understand that we love Jamaica. We love our people. And you see, he became a doctor. Look at his role model.
Yeah.
Do you understand? If you know his mom and his dad and his grandparents, you know the family, you will understand. So understand that when you support JAHJAH Foundation, it is a compassionate act. that you're engaging in, and you're supporting the Compassion Net Fund, and you're supporting all this innovation, because we are revolutionizing healthcare in Jamaica. This brethren, and I'm speaking in Jamaican parlance now,
Yes, man.
this brethren
Yeah,
you see
man.
right here, so is a really hard man.
As real
You
as they
understand?
get, yes.
Him not about no doctorship and no this. He's about helping and caring and making sure that the least amongst us can also be given full access.
Yeah, I just want to say
healthcare.
I'm nothing more than a kid from East Flatbush, Brooklyn. I mean, I was born in Christiana, Manchester, migrated to the States. As she brought me up when I came to the States, and I didn't know I was staying, and that was very traumatic for me, as you know. Right? But I'm just a kid from East Flatbush, Brooklyn,
Yeah, man.
and early on I realized that God was going to use me in a different way. When path was just being cleared for me, so I said, you know what? God, you really gonna do this for me?
Yeah.
And he said, yeah.
Yeah,
He said, but
yeah.
don't forget
Yeah.
why I'm doing this.
Yes,
And I try to stay true to that. And that's why we call it JAHJAH Foundation.
Right, yes. I think I want to honor the memory of his mom, a nurse in Brooklyn.
St. Luke's Roosevelt in Manhattan.
Right, yes, we just want to honor her memory as well.
Legendary.
Legendary, yes. Hazel Dixon, yes, yeah. The late Hazel Dixon. How many years? Perhaps about 40 years in
Almost,
nursing.
right?
Yeah. Uh-huh.
She was a nurse in England, and then she came to America, became a nurse also.
Yes, uh-huh.
It's what these Jamaicans do.
Yes.
You know that?
Yes.
That's what we do.
That's what we do, yes.
I want to thank you both.
Yes,
Thank
you're
you so
welcome.
much.
Thank you.